Something's going on in Mississippi that we should probably all look at, and we knew this was going to happen. As soon as issues arise, they were going to put them in the front page, and this is probably the worst case issues that we're having in the United States. Otherwise, we would have heard about it already. Looks like Poison Control Center in Mississippi has seen an increase of calls taking Ivan, including versions of deworming drug intended for livestock to treat or prevent the current situation we have going on here. It looks like they issued a warning about the phenomenon, they're calling it. And I think the biggest issue right now is they don't want to deal with anything. The hospitals don't want to deal with anything because the hospitals are full. Now, we don't have any doctors that are prescribing this. We don't have any other options. And we'll see in this later case scenario that the few options that they have is limited. People are literally moaning and dying, waiting in line for the alternate options. And the question is, if the doctor's hands were untied and it was available in human form, then would we actually have this issue if we had options to alleviate some of the severity issues that are out there? Now, they're not letting us answer this question because we are limited in choices. And this does remind me of the AIDS epidemic when they went to be treated in Mexico because Mexico was allowing certain options. And it also reminds me of the pro-choice, pro-life argument where people started to go to different places and seek services that they wanted. But the issue had to get proportionally out of control for it to actually be passed or looked at. So you have to really talk to your governors. This can be allowed. It's going to take a lot of petitioning. It looks like the warning comes as Mississippi is experiencing record cases of hospitalizations and intensive care units are nearing capacity. And that's too bad. It shouldn't have to be like this. If there is options that can prevent and be used immediately. Now, if you see anything or any kind of doctor's discussion on this, early treatment is a must. And it looks like even with this, later treatment can even have some benefits. There's plenty of articles that will cover that. So we're going to also see that individuals are describing this and comparing it to chemotherapy, which is horrible. Because one, you can't get chemotherapy at a feed store, and chemotherapy is well known to be a poison. It simply is just a poison. People will die of chemotherapy before their cancer at times, and all of us know this. So I don't understand why they do that. It's not even a good comparison. So the issue really is that they're using the animal product, which is high concentration, which I have discussed in depth and warned about. Really, my concerns were there that dilution is the way I went. And my diary, my video diary, was more of a cautionary tale because it is definitely a concern I had going forward. And it's too bad that more individuals weren't educated. And unfortunately, this is the outcome at this point in time. And it says here that it could cause serious harm. But if you look in the article, it says that only one individual so far has needed supportive therapy. It says most callers to Mississippi's Poison Control Center had mild symptoms, though one person was advised to see further care due to the amount of Ivan reportedly ingested. I've seen at least one individual take 5 or 6 clicks, and that is absolutely ridiculous. Okay, this is not some sort of ice challenge or some sort of TikTok challenge. I'm not quite sure what people are thinking in some instances. I may not have mentioned it enough, but human Ivan is actually in tablet form, which has a slower release, and the animal product is much quicker as it is in a paste. So there's a lot of cautions to be taken with this, and it's unfortunate that it's making news now in a negative way. And so it looks like the mainstream is not going to pick up anything else but negative reports on this. So I can't emphasize this enough. If you've watched this video that I've produced or any of the videos, they're all cautionary tales. Okay, so not only is there concentration issues, individuals attempting this could already be experiencing some sort of kidney dysfunction. As we do know, this disease can wind down the kidneys a little bit, but we do see that only one serious case so far. We have no idea how serious, what the analysis is, or what the outcomes are. A lot of this stuff is still new news here. right? But I certainly won't be like one of these individuals that are on the ground laid out in this other article here. Okay, so we see what is available. It looks like moaning and crying, unable to move. Photos show patients lie on the floor, wait for antibody treatment in Florida, and they're having that, so it is available. It sounds like it could be very expensive. It's very limited, and it's what it is, a striking image. Now, they want you to, as one report once said, wait until you're blue and or wait on the ground in pain for their expensive treatments. And this treatment site is struggling to respond to an influx of patients in Jacksonville. So there's your options, okay? And unfortunately, this is the state of the United States, the land of the free. Our healthcare is in a very questionable spot, and it is so probably because of political pressure. And obviously, there's a lot of money here on a lot of other things that I really don't need to point out at this point. Be careful on everything you're doing. God bless. Thank you for watching.